Hi, my name is Christopher Andrews. My story begins here at Duke University, where I had a life-saving bone marrow transplant as an infant. Now, 20 years later, I have revisited the place where this all began.
Yeah, when you had your transplant, it was in the early days of doing cord blood transplants, and it was still experimental.
I remember you had amazing hair and you were just the most adorable little boy, and everybody on the unit wanted to take care of you.
There were only a few hundred people in the whole world who ever had a cord blood transplant. Now there have been over 40,000 people. Cord blood is now a standard treatment for people who don't have a matched donor in their family, but the basic principles of transplant are the same. You have to get high-dose chemotherapy, your own bone marrow and immune system have to be wiped out. The donor cells are then infused and they can replace your bone marrow and your immune system and correct the disease.
I was diagnosed with a leukemia. And at that time, I was here at Duke getting the routine testing, and they were just starting the process of opening up the the bone marrow transplant unit. So Dr. Kurtzberg approached my family, and because I had a closely matched sibling, they chose me as the first transplant to do at Duke.
We do have some of the sickest patients in the hospital going through transplant just because the transplant process affects every system of the body.
It is easier now. It's still hard though, I don't want to misrepresent it, but it's easier than it was because we can prevent complications.
We've gotten better at being able to identify graft versus host disease, which can be a serious or deadly complication of transplant. That's something that we've been able to identify earlier and treat better.
When you have a transplant, you have to be in the hospital for weeks to a couple of months, even if everything is going perfectly. And that's a very long time to be in the hospital, confined to a room.
People put their entire lives, I'm told, to be here and to ensure that their child gets the care they need to get through transplant.
The Connection Room and the whole family support program that we have, which we fund through philanthropy, is to try to normalize life.
I'm with the family support program here on 5200. The family support program is a really unique nonprofit that partners with Duke. We provide a bunch of services for our inpatients and outpatients, including a volunteer program, daily activities here in the Connection Playroom.
It's a good program for the whole mind, for the whole body, for the whole soul. It is very instrumental in helping my son to have positive thoughts throughout the day, or if I could just make it a 2 o'clock activity time, I can get out of the room and do something fun.
There's no way that transplant does not change your life for the family system as a whole dramatically.
What we find is that people who go through transplant often have to reprocess things at different stages of their life. So a child who's had a transplant very young will deal with it, in their very young mind and in the developmental stage they're at that time. But when they get older, they may need to rework through some things. Sometimes it's not really evident that it's related to transplant.
We're always kind of pushing on the edge and developing new therapies. We have research labs developing new ideas, and we bring forth some of those ideas into treatments that we develop for the clinic. So we have kind of a continuum of doing transplant, but then trying to improve it and also apply it to other diseases beyond the traditional ones that people think about. So an example of that is now we're treating adults with stroke with cell infusions, and because cells can help heal the brain. In the best of worlds, if no one needs a transplant because there are easier, safer therapies, that would be a good thing.